principal components, there are the consumer, there's the provider, and there's the structure.
Consumer, provider, and structure?
Yeah, well, I'm gonna go through it here now, so who is a consumer? When you're dealing about healthcare service delivery systems, who do you think is a consumer?
Person needing the healthcare.
Right, anybody who needs any form of healthcare, right? I just wanna warn you, in one of these slides, there's like this really weird noise, and I didn't take the time to take it out, so. Direct providers, there's medical professionals, there's allied health professionals, and there's paraprofessionals. But
Just, if we could just get a moment so we can write this down.
no, no. Do I need to go back a slide?
I was just wondering,
Yeah.
the three
It's this one right
principles
here.
is consumer, provider, and then it doesn't, I don't see where it says what the
Right.
last one is. Structure?
Yes.
What was the last one?
Structure what?
Oh, yeah.
I'll go back. I'm just going back to clarify for everybody. Hold on.
Structure.
Okay?
Okay.
Consumer provider structure. CPS.
We're good.
More abbreviations.
No, it's just, no, it's just, it's very helpful.
Overload. Shorten out here.
Okay, so this is where I left off, right? Okay. So,
We need to
the
go
back
back
one?
with these.
Yeah, that's still.
That one right there, yeah. I like that.
Paraprofessionals are like CNAs.
Would they call that a rehab tech too? Or no?
Yeah, a rehab tech. All right, I'm rolling on, guys. And who are the providers? There's indirect providers, like our legislators, our politicians, our city planners, third-party payers, and social services. These people play a big role in what happens as far as payment and regulations. Okay, and then we have the government regulatory personnel, which is like the Department of Health, the Department of Medical Quality Assurance.
They all look like him.
Okay. What'd you say?
So they all look like him.
Yeah. Blue suit and red tie, right? All right, I'm going on. What is structure? It's the levels of healthcare, the settings, government's role, quality, availability, finance mechanisms. Oops, I'll go back. So levels of healthcare are like the doctor's offices, the walk-in clinics, the hospitals, the outpatient surgery, that kind of category. And then settings would be like a hospital, a rehab hospital, nursing facilities. Just to give you an example, you don't really have to know that. And I touched on the government's role a little bit, but the government has a big role in funding, such as Medicaid and Medicare. That's all governmental funding. WIC is a government program, and SNAP. They don't call it WIC anymore, right? They call it SNAP.
That's what.
Okay. The quality, availability, certain review boards that, assess quality, like in the nursing facility, you have a risk management, and they assess infection control, they assess, incident reports, so there's some kind of a quality